I'm going to just announce this on the show. Believe it or not, just kidding.
Oh my God, I don't think it's under question.
Had plastic surgery. Daily Logic Check. Welcome to the surgeon's edition of Daily Logic Check, where we talk logic regarding plastic surgery. I'm Elizabeth Vargas, your host, with my co-host, Andrew Vargas. Today we have Dr. Gabbay, the world-class surgeon from Beverly Hills.
Hi, Elizabeth. How are you?
I'm so fabulous that you're here today.
I'm so happy I'm here.
I'm excited that you made it.
Perfect. Well, thank you for having me. We have a lot to talk about.
You know, it's interesting because when I had called you, Andrew and I decided we're going to launch a podcast and we want to talk logic. We want to talk to smart people and people that have been in their industry for years, know what they're doing, know what they're talking about, I've worked with before, and you were the first person that came to mind.
I love it.
Before anybody. But I couldn't launch with my plastic surgeon.
No, of course not.
I had to wait a couple shows.
Wait a few.
Ease into it.
Ease into the lipo.
This isn't the most important thing, I promise.
Yeah.
I know. I started with Emily from The Housewives.
Yeah,
and then, I went to John Paul right away.
Right,
Then I had to get, wealth management.
Yeah.
Then go to the lawyers. And now I'm back to my surgeons.
That's it. That's good. You set the groundwork, and now I'm here. I'm ready.
Yeah. Well, you worked all day today.
I did.
So what days are your surgery days?
I operate on Monday, Wednesday, and Monday, Wednesday, and Thursday, and see patients on Tuesdays and Fridays. But we always.
You're just everywhere, whatever.
I'm always working.
Well, I've known you for how long now?
Was it like 8 years, something?
So Andrew, I'm gonna just announce this on the show. Believe it or not, just kidding.
Oh my God, I don't think it's under question.
Had plastic surgery. Dr. Gabbay was the one. Remember when I had fat arms? And I was like,
you were so happy when you got that done.
I was complaining that I couldn't get in my suits. And who did I meet you through? Who introduced me?
I don't remember.
It wasn't my Botox doc. It was,
I don't know. We just somehow were there. And see, those things don't matter anymore.
Yeah, because I've known you for so long, but you're from Beverly Hills and I knew you must be good.
There you go.
If you can afford that rent up there, then.
It's a thing. It's a thing.
It is a thing.
You can't suck to make that rent.
Can't suck. No. So I remember I've always, I'm hesitant to get plastic surgery, but I know if you get just enough or if you just get a little tuck here or there, it's subtle, that you'll be good. I don't like to do the overall overdone lips, the overdone everything, right?
Right.
And I remember whoever it was, I can't remember, told me to go to you.
I love that.
To be subtle. And I didn't want the full lipo because I had already had bad lipo on my stomach.
Yeah.
I mean, I've got, that we can't fix it, right? So I wanted my arms, I wanted my arms, I wanted my legs, I wanted a little tighter. And so what was the surgery? What was the...
we did your surgery, we did lipo, we did it awake.
Yeah, but we did it, I was awake, but was it a...
Cold?
Definitely not. It was liposculpting, but it's that poking... Yeah, and I was awake.
It's just lipo.
It's just lipo.
Yeah, it's just lipo.
They call it a fancy name. He's like, it's freaking lipo.
Well, we were talking to Emily about it, and she wasn't sure. She couldn't
Emily from
remember.
The Housewives,
and she's like, if you were awake, it couldn't have been regular. But apparently she was. Oh, apparently.
Okay. I want to go all into different types of procedures, but for now, I want my audience to know really why I stuck with you, why I believed after I was finished having my procedure with you, I have told everybody about you. And it's not just me feeling good about my body and you making me feel comfortable in my skin again and wiping my divorce right off my hips. It was amazing. But you also have a great personality. I really enjoy hanging out with you, and I really got to enjoy. I got to know you through your Instagram, and I know that you have a beautiful family. You visited me at the Madison Club.
Yeah, you were so nice to have us.
Yeah, no, you've been just a wonderful friend. But I don't know this. How did you decide when you were a young kid you wanted to get into plastic surgery or be a doctor, or how did that come about?
Absolutely didn't.
No.
So I've said this story. I was born in Iran. I grew up in Beverly Hills. Came to the States when I was 4.
So you were born in Iran. Okay, got it.
Can't be your president. Sorry, I know.
Oh, can't be your president. Damn it,
I know, it's tough. So my dad is an architect, and forever when I was a kid, I was like, this is great, I want to do it. I loved it, it was fun. To the point of, you know, like even in high school, my high school actually had architecture classes, and I loved it. I studied art and architecture in college, but it was really sort of high school, college that my dad helped me realize architecture is the greatest art and the worst, the shittiest profession in the world.
Oh.
So, you know, I very quickly realized, hey, this isn't for me.
What you want to do.
So, you know, like any good
but you're an architect,
boy.
you're a body architect.
Well, so that's it. You know, now I tell people my dad and I do the same thing.
Yeah.
We just use different materials.
There you go.
Clearly.
So yeah, you know, I decided to be a doctor, and that was just sort of almost arbitrary because, you know, I was good at science and whatever.
Right.
But as I did research more and more, I just started realizing plastic surgery is it for me because it's there's artistry in it, there's science in it, there's anatomy, there's, you know, it's this crazy thing where you get to literally create something out of someone's body.
Right.
And not just for the cosmetic stuff, you know, the reconstructive stuff I used to do a lot of. It's all of that. It uses your brain in a very special way, and it just works for me.
Yeah.
So
where'd you go to school? Where'd you?
I went to college at UC San Diego. I went to medical school in the Medical College of Virginia, and then I did my training at Cedars and UCLA. Great. So, you know, kind of a local boy.
Yeah, your website says you have 6,000 procedures under your belt?
Yeah, I've done a couple.
Oh my God. Well, let's see. Out of 6,000, how many have we done? I'm just curious. Asking for a friend.
You're the bulk of it, no.
More than mine.
I have never had plastic surgery. You know those people that walk around and are like, oh, I don't have my son. I'm not talking about. I've never had Botox.
It's weird that it's like plastic surgery that has created a whole new look. Like it's not a natural, and it's so crazy how many people you see has that look, and it doesn't look real at all.
Well, so the good thing is those are just the ones that you notice, which means there's a whole universe of people who've had work done, but you don't know because it looks good.
Yeah.
So,
exactly.
you know, there is literally
That's
an
true.
industry
You don't notice,
of
you
shitty
don't...
plastic surgery.
Well, no, I bet that's what I'm saying, but it's kind of weird that plastic surgery,
think about it
the
that way.
industry has made a new look that's not natural.
Yeah.
But people want to look like it. So that's
right.
Yes, it is. It's weird. It's each his own. If that's what makes you happy, that's fine.
Yeah.
But it's weird that it's made a whole new look of humans.
So I haven't thought about this, and it's so true.
Aliens,
and
Andrew.
I'll tell you, you took this idea that I've been thinking about for so long, and you put it out perfectly. Because look, think about it in the old days, right? Before social media, there was sort of the look. You know, in the 80s, it was just this. In the 90s, it was big boobs, tiny butt, tiny body. In the 2000s, it sort of flipped around where it was huge butt, tiny boobs, whatever. And now we don't know where we are anymore because we've done everything.
Oh, we have alien heads coming with big
exactly.
eyes that go. No, they started the eyes now. They already started going like this. Now they just got to get big round ones.
There you go.
We're all aliens.
But the good thing is that now, and this is kind of your point, there is a niche for everyone. Because of social media, you sort of find your people. There is the group that wants the crazy, overdone, fake, nuts look. Sorry, you can't find me there.
That's not your
say
market.
whatever you want.
That's not your market.
That's not me. This
is a freedom of speech
I have friends.
podcast.
They're great. But like, there is a right place for everyone, and it's kind of cool because now we live in a place where you kind of say, "Hey, I want this look. I want that look. These are my people. That is my guy. That is this. That is that." You know, and it's nice.
It's because I call you and I'm like, okay, recently I want my little. I got a little poof, you know. I mean, I did lipo on my stomach and a little bit on my legs, and now I've got a mini poof right here.
I know.
On my little, you know, my girl. And I'm like, sorry, Andrew, just shut up.
Earmuffs. Just say earmuffs. Come on.
I put on little, you know, tight pants, and I sit down, and I'm like, what?
And they're there.
Where did that come from? And it's from the lipo, right? Because there's nowhere for the fat to go. It just went there, right?
Actually, it's a couple of things. Sometimes the fat may not have been taken out properly over there. By the way, did not do her lipo there, okay?
No, full disclaimer, I flew to another state and they screwed it up big time. But it's getting better now, so.
But the other thing, and actually what usually causes that issue is that it's the fat's gone, and before the fat was holding out all your skin. But when you get rid of all that fat, what happens to the skin? It drops down because it doesn't always have the elasticity.
Oh, no, I don't have the drop. I just have the poof.
So that could just be
So
fat.
you just do the little lipo,
But sometimes, believe it or not, that poof looks like it's
Is
fat.
it Vipo? Vagina lipo? What is it? Vipo. Andrew's like, why am I on this podcast?
I gotta
Andrew
go.
sure says I'm fat, okay? So
I mean, if you want to go there, some people call it the fupa.
the
Yes,
fupa.
fupa. That's I couldn't remember
And
that.
you can call it fupa suction. That's a thing.
Anyway,
I'm
okay.
trademarking this. But yeah, so it can be fat, but sometimes it actually looks like fat, but it's just the skin sort of folding over itself or dropping down and bulging out because the skin there is pretty thick. And you got to do a lot. There's a lot of creativity that goes into the fupa.
But my point is that there's a lot of crazy surgeons out there that will do anything. But what you do is very subtle work. Like, when you did my arms, under my arms, I hands down cried. When I got home and I finally healed, I had my suits in the back, and I had gotten through this divorce, and I had gained a lot of weight. I don't know why. I could not lose weight. I wasn't even eating, and I was gaining weight. I don't know what the heck was happening. And I looked at you, and I said, please just wipe this divorce off my body. Yeah. And you said, let me help you. I'm going to do it subtly. You can't do it all at once. And you were very logical about my requests. You told me what I should expect, not what I want. I want everything. I want to be, what is the realistic results that I'm going to give you is A, B, and C, and I can't give you any more, or I'm not going to do it.
Right.
And when you say you're not going to do something because I want something extreme, that means you're a good doctor to me.
Thank you.
And so tell me something. So you moved to Beverly Hills. You and your parents live here, or your family all live here.
Yeah.
And then you started to practice directly in Beverly Hills right after school, or how did you?
Yeah.
Because Beverly Hills is pretty astute. I mean, that's like the place to practice.
It was, everyone was like, what the hell are you doing? Why are you going to Beverly Hills?
Right.
There are already too many,
is
right?
Crazy.
Well, number one, I wanted to. Number two, I wanted to. And number three, I wanted to. So I did,
That's three good reasons.
Yeah, and that's all you need. I obviously, it was hard. It was really hard. Yeah. I had to learn, I had to grow, I had to struggle, I had to hustle, all that stuff, but it was worth it.
How long have you been here?
I've been in practice now for 13 years.
Okay, so it was worth it.
Yeah. And, sometimes I hated it. Most of the time I loved it, even when I was struggling and building a name and stuff like that. Because, for one it is the mecca of plastic surgery, and so there's so much creativity here. There's so much of a push to be the best in the world. And when you have that burning at you, you have to perform, otherwise you'll die. And you take your craft to a place that's going to be great, and it benefits the patients.
Yeah.
And it constantly, has this creativity burning inside
always
you.
stimulated on
Totally.
what's next, what's the
Yeah.
next procedure, what are they trying to sell to the customers, but when it's really just lipo.
Right.
What are they bullshitting the customer with, and
Right.
how can I educate my customers?
You have to be great every time.
Well, you do now, because this is the other it's such an interesting thing. In the old days in Beverly Hills, I think as the community was making a name for itself, look, there was no social media, there was no Yelp, there was none of that
There
stuff.
was no Instagram.
So if you mess somebody up,
Oh
nobody
my
would
God, you don't know. I've seen some of the work I've seen from the old masters of plastic surgery is horrifying. I look at these, these old ladies usually who've had, they come in and say, I had my boobs done by so-and-so, and I'm looking, I was like, what the hell is this? But it didn't matter
They're
because...
winking at you, red light, green light, red light.
Where am I supposed to look?
Right. But, at the time, they're like, look, I got boobs. And they didn't know what's good, what's bad. And legitimately, these old guys could get away with it. Now, look, they were brilliant. There are a lot of really great guys there.
Pioneers, yeah.
Right. But it was a different world. Now, obviously, results vary, and I try to do the best results I can, but it's kind of shitty that you're always in fear of well, what if I get a bad review? What if this doesn't happen?
Yeah.
What if that doesn't happen? And it's the reality of our lives. Restaurants are like that right now.
Yeah, you got to be a lot more
Restaurants can't
conservative.
thrive. everyone is afraid of whatever they do is just broadcast out to the world.
But it is
to
like
see.
like you think of one girl influencer is going to want to look like that other influencer, but she doesn't have the same physique, but she wants that look.
Right.
And so if you don't give her that look, it's your
Oh, it's
fault.
your
But
fault.
that's
Even though
why you
her
would rather
boobs are
just
sideways.
And
send them
that's
to
why I
someone
say
else.
no.
That's why you say no.
Absolutely.
Because you
okay.
don't want,
Yeah.
if somebody's asking for too much, you're like, I can't do that.
Right.
She's going to leave a negative review no matter what I do. It's going to be,
Exactly.
I'm just going to go have this person do it.
Yeah.
You know, he might be able to do it. I don't want to take the chance.
Right.
Because it's not worth your reputation to have somebody.
Oh, so you say no a lot, or
Oh my God, so much.
really?
Yeah.
I feel so special.
You know?
Thank you.
Believe it or not, Elizabeth, our conversations were also very important in sort of helping me grow to understand, you know, where do you stop, where do you not? Because, you know, you and I, by the time we were talking about other surgeries, we knew each other well, and I wanted to help you.
Yeah.
And I wanted to say, fuck it, I can fix this. No, someone else did it. You know, I can fix it. And I had to say no, which, by the way, I mean, technology and life and everything changes. So like these are things that we can always revisit in the future. But, you know, at the time, it was very much a, hey, don't mess it up more kind of realization. And yeah, I love to say no, because if I know that I'm not going to help someone,
It's useless. She will give you a bad review.
yeah.
And there are some.
And I mean, forget about the reviews. You're going to mess someone up.
Yeah.
You know, your whole job is to make people's lives better.
Yeah.
Not worse, just to, you know, make a buck or for the ego of saying I did this on this person or that person, whatever.
And I know that you have a great referral system too, though, because if I think I've called you for a number of my girlfriends have wanted specific surgeries. And you say, no, I don't do that, but I have somebody that I trust.
Right.
So that's important too, right?
Yeah. Yeah, well, and you know, it's funny because look, as you know, I'm a board certified plastic surgeon. I train at UCLA. I train at, you know, all these places. I know how to do these surgeries. But again, this goes back to where we are.
What are you good
in
at?
Beverly Hills, you've
What are
got
you
the
great
best
at?
people in the world for every single procedure. Exactly. Where, yeah, I could probably, I can do a good nose or eyelid or whatever, but you know what? I don't do it every day.
Yeah.
But I have a friend who does it every single day.
Remember I told you that. I go, he does this specific type of surgery, and he's good at it.
And that's a smart, that would make me feel comfortable as someone going in. If they're like, yes, this is what I know that I can get exactly the results that you're asking for, I can do it. We don't want to do this, this, and this. That's their job.
Right.
The more narrow the field, the better your results.
For sure.
will be.
And it's hard though, because
You know you could do it.
I
and you're
know,
gonna,
and I love to do that. I miss doing noses. I miss doing eyelids, you know. But
well, you
pick and
referred me to
choose.
Kama Parsi.
Kami
Kami
Parsa.
Parsa.
Yeah.
He did mine.
Yeah.
Yeah.
And he does magical
excellent
work. Kami's fantastic. Among others who I really consider masters in that field.
Yeah.
Because, you know, not everyone's going to mesh, let's say, with Kami. So I want to have a couple of names of,
different
hey, you don't
referral.
like him, you know, you go to this guy, you go to that guy.
Yeah.
You go to Chris, you go to whatever. And this is the fun thing about this, where you say it's a referral network, but it goes both ways. You know, for someone to trust me, to ask me, hey, who do I go to for this? Number one, I want to give them the best in the world, and number two, I want to validate them as a friend,
Right,
You know, and as
absolutely.
an acquaintance of just like giving them.
Well, you're all under the microscope while the patient's under the knife, and you watch each other's. Like I've been watching your social media, and you're doing an excellent job, by the way.
fun with
It's
it.
really educational.
I love
No,
that.
I've never, ever. When I started doing plastic surgery, they didn't have Instagram where you could scroll
Right.
and watch a procedure.
Right.
Literally,
That's
I
crazy.
can watch him suck a gut out from a juicy. She's looking juicy to looking stellar, and you're like. And also tell Andrew about the before and after pictures you've been doing and like, educating us on, because they trick you, but you don't do that. You're like, this is how people.
I just watched a video about this.
Yeah.
Yeah, that's
So it's funny. Let me tell you one reason why I love the educational stuff.
Yes,
it's
you're great
really
at it.
fun. I enjoy teaching and stuff like that, but it's also by necessity, because Instagram has gone hard against plastic surgeons showing any sort of body stuff because they think it's, you know, bad for body positivity, it's
Really?
nudity, it's graphic,
Oh my God!
all that
Is Instagram
stuff.
half porn?
Yeah,
And
that's
they're
what I
like,
saw
yeah,
yesterday.
let's not
Exactly,
show
like
us.
they can do it,
There's
but I
like
can't. That's
porn
a whole thing.
everywhere.
Exactly.
Show me, what's the website? Only show me
OnlyFans.
your toe.
OnlyFans.
But you can't have your surgeon. Okay, anyway, go
Right.
ahead.
So, that's a whole thing, and I can talk about that forever. But yeah, this whole thing about how people mess with photos is a whole, it's a world unto itself because, surprise, not every picture on Instagram is real.
It's real. Yeah. And it's all about lighting and about everything.
And it's not just the Instagram models that do it. It is surgeons. It is other people who try to say, hey, this is my work. Well,
they steal your work, right?
I've had that. Yeah, I've had that happen before. But even to the point of saying my before and afters look like this, where the before they'll just put lighting in a way that it just makes the body look horrible and, just everything is off. And then in the afters, the lighting is totally different. Their position is totally different.
Yeah, so I was watching a video where he'd worked for UCLA. They were talking about they used to employ a full-time photographer and a set for the before and afters. And they made sure they wrote down every lighting setting and everything. So the before and afters were a true identification of before and afters.
Right.
But they don't do that anymore. And everybody will have, like you say, crappy lighting on the before, so it looks like they're even better than they are.
Right.
And people are starting to call them out on that.
Yeah, exactly. And I mean, it's good that people are they're aware of that. What's interesting though is also social media is it's a consumer-driven thing. Like it's your job to consume it, right? So as someone who watches it, you kind of just need to be smart and say, like, you kind of see through the BS. You see through a pose or lighting or something like that. And, a point that I was making in that post is, it's the most apples and apples thing if all of the photographic conditions are the same. But you know what? What if you do show someone who the before is like this very plain clinical picture in the photo studio, but then their after is at the beach in a bikini posing.
With perfect lighting.
It's like a real,
it's interesting because it could be a good thing too, even though they're total apples and oranges. You see that this person is living a great life with a great result in, sort of the way they want to be.
Yeah,
but if
how they want to look in those new boobs or whatever.
Right.
Before and after plus the lifestyle, that would be more realistic.
So that's a great point. I love that. And the more information people give about, like this is the before and after, and then like you say, hey, look how happy she is.
Look how happy she looks.
Andrew, I'm a pure. Look how happy she is. I went and got all my wardrobe out of my warehouse just so I could start picking through it now that I'm skinnier.
That's funny. That's fantastic.
Daily Logic Check.
So let's talk education. My audience loves to learn, and they're thinkers, which is great. So as far as continual education, do you have to continue? Okay, so what type of degree do you have to get? Do you have to have continual education or to be certified, or how does that work?
There are a couple of different things there. The California Medical Board mandates that any doctor needs a certain amount of continuing education over their career. So every year you need to do so much work, and we can talk about what that is. Then you have subspecialty boards like the American Board of Plastic Surgery that will also have its requirements, which are usually greater than what the state mandates. And then what is that education? It can be anything from going to a conference or...
Who governs all this that you did it? I mean,
So it's mostly voluntary information.
Okay.
Self-governing.
Exactly. But every now and then, the California Medical Board is going to send out a random, like, hey, show me proof that you've done this.
Kind of audit your
they
books.
audit your
so they have like a surgeon's audit system?
Yeah. It happened to me once, and I passed with flying colors. Everything was okay. And I mean, it doesn't, from what I understand, it's not a malicious thing, let's say like an IRS audit or whatever.
It's not like an IRS where they just show up and take your shit.
It is if you're lying about it. It'll feel like the same way.
Exactly. And I actually asked the person, hey, what happens if I don't have this information? And you know, the guy said, look, we're not out here to screw you. We just are going to tell you, do the damn work, and then show us, and that's it. And of course, if someone's a repeat offender, then that becomes another story. But it's great that we have that because, yeah, you kind of want your doctor to know what the hell they're doing and stay up to date and stuff like that.
So that's what. So when they say the continued education, it's like new procedures, new studies.
How do you learn about everything new?
Anything. I mean, that's what they want you to find.
Yeah.
That's
well, you know what's funny is the old way of learning new things was horrible. The old way of learning new things, what would happen was there were several different ways. You learned from textbooks, you learn from conferences, you learn from journal articles, okay? And usually the way it works is the most innovative stuff was put up at a conference, and then a few months later they would put it in a journal article, and then a few years later it would be in a textbook. So by the time, I don't know, you're getting to something, it's already kind of been out there for a while. And in one regard that's good because that also shows that it's been sort of tested and
vetted.
All of that, exactly. But now, how do you think a lot of surgeons learn about what's new and big?
Instagram.
YouTube.
And it's...
Well, like the threading. That weird shipping. Like some of the housewives, they actually ruin their nerves.
Oh, it's terrible. The threads,
their faces were sideways.
Yeah.
When I was on the show. I was like...
and that's the thing, because a lot of surgeons will see it on social media and they're like, I'm going to try this. You know, and they do it and they don't fully go into what do I need to learn or how do I do this properly. And I mean, look, there is artistry in surgery. So you as a trained surgeon should have the ability to sort of, you know, manipulate what you do a little bit in a smart way.
Right.
But then you also have to know how, like something like a device, like a thread, there may be nuances about it that you simply don't know, and you got to get that right education.
And has it been around long enough to know 5-10 years down the road what it actually is going to be?
Exactly.
But
what's going to be the result?
Who
long term
certifies that that's legal to do?
Well,
like
so
what does it go through the who?
So as an example, the threads, it's very easy. The FDA clears it. This is run by the Food and Drug Administration.
Crap.
Yeah, no, they've got to do that. That's actually pretty straightforward because then those companies are really obligated to have specific training, specific guidelines, and all that stuff. But then every now and then you get into just a new surgical technique. A technique does not need any sort of FDA clearance or oversight or anything.
There's no product that's going in your skin.
It's just, hey, I came up with this idea. I want to try to do this. Like something that people are doing now is called RAFT, rectus abdominis fat transfer. So there's this whole thing about fat graft.
Fat out of your butt?
Butthole? No.
Rectum.
The front. Rectus. The rectus abdominis are the two six-pack muscles up in the front,
I'm
right?
like, there's a rectum surgery procedure. You take your butthole out, stick it on your chest.
That's another kind of doctor.
That's another place.
Yeah. So what guys are doing, or doctors
guys,
are doing,
there you go.
they are... Instead of doing that, you know, there's been this whole thing towards high-def body contouring, right?
Okay.
Like where you sort of show the muscles and stuff like that. It's beautiful. It is very sculptural. People are using fat now and putting it into those six-pack muscles to bulk them up a little bit. We can.
Because I saw on your social media that the reason there's lipo, or there's not lipo, there's cellulite on your ladies' legs is because there's these bands between the fat and the skin.
Yeah, someone's paying attention.
Yeah, well, no. And then I thought, oh my gosh, so when I have a little bit of a bumpy stomach. It's not terrible, but it was bad plastic surgery.
Yeah.
So I'm embarrassed to wear a two-piece.
Right.
So I thought, okay, maybe if I put little fat back or something, or
so that's why you're smart. You're correct. Your intuition is absolutely correct. And actually, this is something that I was thinking about doing with you. But and we'll go to that.
Okay.
What I'm talking about, this raft thing, to the earlier point of what's safe and not is. What we're talking about is into your skin, underneath your skin. This is literally into the muscles that make your skin.
They put fat. They basically inject fat.
Bulk it up.
Into the muscles?
Into the muscles.
No kidding.
And I mean, listen, it's a technique. There are a lot of really good surgeons who are doing it. It is something that is positive. But you're putting things in a place where, you know what's right underneath there? Your colon.
your arteries,
your intestines, organs.
Organs,
so
I mean.
you can, if you don't know what you're doing, you don't do it right, you can really mess someone up. And that's just some guy saying, hey, I saw this on Instagram, I'm going to try it now on my next patient.
I'm just going to poke some fat in that muscle.
so there's a lot of wiggle room there. What's good, what's bad, who should and should not be doing stuff.
Speaking of wiggle room, how does a potential customer, client like me, vet a good surgeon? How do I know? Like, I know that I have a good ecosystem of people that I can see their bodies and I go, who did you go to? But there's some people that don't have that.
Right.
How do they find the right person in their area, or how?
I mean, that's the biggest question. Such a great question. And, you are lucky that you have had a lot of friends around you with good work. But even with that, there are some people that you still need to do your homework. So what does homework mean? Things like, number one, making sure someone is certified by the American Board of Plastic Surgery. That's really important because that is a board that really is careful about vetting surgeons who are safe and qualified and well-trained. And it's tricky because there are other kind of fake boards out there like the American Board of Cosmetic Surgery, which sounds really official, but it's not. Those are doctors in those boards that have not had official plastic surgery training. But that's just the groundwork. Then you got to look at results. You have to make sure that this surgeon is doing work that is what you want. And then you have to make sure that that work is good. Look at their social media like crazy. Pinpoint all of their before and afters. Make sure they're not bullshitting you with their pictures.
Or they're stealing somebody else's before and afters and saying
or manipulating the photos.
Yeah.
Look at their reviews. Look at, just look. Try to find people who have actually had work done by that doctor to get a sense of their experience. Even if that means going to the doctor and saying, hey, do you have any people I can talk to? And then finally, it's that thing of go to the doctor, connect with them, see if this is someone who you want to work with. Because, just look at us. We're almost a decade into our relationship now, and this is truly a relationship where you're going to be with this person for years, and they're going to understand deep things about your body, about things that, other people don't know about or anything like that.
And your physiology of what your expectations are.
Exactly.
Especially getting older and aging.
Totally.
You're always going to be with me.
Everybody's body's different.
You're going to be stuck with me.
Exactly.
We have a closet somewhere. Put the surgeon in it.
Exactly.
No, but
it's because there are a lot of great doctors out there, but that doesn't necessarily mean they're the right doctor for you.
Right.
And I actually, it's funny with social media now, I put myself out there, and for the most part, people, they kind of know who I am before they come to me. And I know that while, let's say, the presence I have on my social media brings people to me because, hey, they like me or whatever, I also know that there are people out there who are like, not for me. He's not my guy. I'm going to go to someone else. And I think that's good. I think that's fine, because you want to work with someone who you connect with.
Yeah.
So
your life's in their hands.
Yeah.
So you want, as a customer, you want to be comfortable with my life in your hands.
Exactly.
And explain to my audience this procedure that I did. I was awake. Now, Emily couldn't believe that I had lipo awake.
Yeah.
But I did, right?
Absolutely.
So explain how that works.
So, lipo is lipo. It's something I say all the time. It doesn't matter necessarily how you get it done. Little tube goes under the skin, sucks out the fat. Okay. Obviously, there's a lot more there. But the key is, okay, well, how do you keep someone comfortable so that something going under their skin isn't super traumatic? Well, the way I do it is...
It's great.
I think so. I gave you some medications to just help you relax, but we were chit-chatting the whole time.
I was Instagramming.
Exactly. And then I take a very thin little blunt metal tube, put it under the skin, which gently will put in the numbing medicine. Okay. And there's a special way of making the numbing medicine so it does not hurt or it minimally bothers you when you put that stuff underneath your skin. Once that numbing medicine is in, assuming you as a surgeon are good at doing it, because there is a lot of artistry into getting that done right, you're comfortable.
Right.
And I can go to town with the lipo. You know, I
Yeah.
can I've taken out huge amounts of fat from people who are fully awake. I've done tummy tucks, I've done breast lifts, I've done arm lifts, I've done major procedures with people just chilling comfortably.
Well, no, I've watched your
on
Instagram
Instagram.
where they're awake and you're literally pumping into these containers. They're fat. I'm like, okay, I'm grossed out, but I'm intrigued because I don't even know what to do. Should I walk away from this train wreck or keep watching? Because it looks like it's going to turn out pretty good.
And it usually does.
And the reason the fat doesn't come back is because there's no more cells to divide into more fat cells.
Exactly. And that's another really interesting question of what happens to that fat.
where-
So there are two different views on what that is. When you get rid of fat, is it gone forever, or do new fat cells sort of replicate in that area? And you know, the science is actually still not there. We see both, basically. There is a dramatic reduction in the total amount of fat there. There is a small amount of fat replication or fat growth in that area. You know, if you eat too many cookies, something's
If your body
coming
says,
back.
I need a bunch more
So
fat
you
cells, to start.
can gain more
Fat back.
fat cells then. Because I was told you're born with a certain amount and that's it.
No, that's kind of BS.
Okay.
And that has never
And then they
been
just
proven.
expand and get super fat.
So
and then
that, again, controversial point. Do they grow or do they duplicate or
Right.
whatever? And again, the reality is a little bit of both. And then what's also a controversial and interesting point that not a lot of people, people don't know the straight answer to is, okay, if I get fat taken out in my waist, right? And then I gain weight, what happens?
gotta go
Does
somewhere.
that weight gain evenly throughout the body, or does it go to another place like your arms or your
butt.
thighs or your butt or whatever? And that idea has actually been a reason to justify doing fat transfer. Interestingly, because what happens is you do lipo, right? You take out those fat cells from the trouble spot that they always go when you eat too much, right? You take out those fat cells, but then you put them in an advantageous place, like putting it in the boobs or in the butt, so that if you eat too much, those fat cells are still there.
they
and
complement that area.
So you can
grow
take them
in
out
a
of your
good
body,
way.
and then you can put them back in somewhere else.
all day, every
and
day.
and there's enough blood flow to keep them all alive and everything.
Exactly.
Oh, that's kinda cool.
Yeah, it's great. I mean,
Interesting. Can you put them in your bowls? Like,
So is that so when you
can guys get bigger
so
bowls?
when you're saying
I can work on that.
when you're doing the inner muscle or the
curious,
sculpting is you can take it from somewhere else. Like let's say she could take some out of somewhere like on her legs or whatever, and then you can move it to her stomach and to make it look more natural.
Correct.
But
So
you don't mess
that-
with the butt, right?
I do it all the time.
Oh.
If you did want him to mess with your butt, he didn't have to mess with your butt. But he could find the fat somewhere else.
Yeah, I mean, and actually your point is perfect because, your stomach, in my eyes, is almost like a reconstructive thing, right? It was it's not that bad.
Well,
Let's
they
face
took
it.
out every piece of fat possible. There's
So
no
they
fat
took
on
too
there.
much.
There's
and
no
that's
fat
a
left.
mistake.
Zero.
You need to leave
Yeah.
a thin,
Yeah.
beautiful layer of fat that's not bumpy and stuff like that. Sort of like that
I'm not like
terrorita-
completely jacked
No,
up. I
you're
mean, I
not
look
at
good.
all.
I
I
just,
The way you
know.
make it sound, it sounds
for me, it
horrible.
sounds
Exactly.
terrible. My audience, I am not that
She's
fucked up.
beautiful. Are you kidding me? So
It's not like it used to be.
Well, but and your point is very smart. It's okay. You took too much out. Well, you can put some back in. You can sort of clean those mistakes.
Is that something that like you do?
Yeah.
So wait,
there
could
you
I
go.
take a little out of that little puffy and stick the little puffy?
Yeah,
up
moving
there?
around.
So I could have like vagina gut,
Uh-huh.
a VG.
There you go. Whatever you want. The only limit is your imagination.
I'm like, okay, we're gonna
He
go
might
here.
not do it, but somebody will.
Exactly. There's a guy in TJ I can refer you. It's fine.
TJ. That's hilarious. Oh, and speaking of TJ, a lot of people go to Mexico or Brazil or Italy for these procedures, but when they get messed up when they come home, they didn't heal properly, no surgeon's going to touch you, right? Like, it's not worth it, in my opinion.
So that's a whole nother story. Now, I'm
They
the
wanna
chief
save
of
money, and
plastic
they're like-
surgery at Cedars-Sinai. Cedars is a huge referral center for all the disasters that come into LA, and I've had to take care of some really, really big disasters of plastic surgery from outside, from other countries, other whatever.
That's a disaster.
And it's a disaster. And there are some cases where people have come close to dying or have died, and it's really sad. It's a tricky thing because, look, I don't want to be this guy who stands on the pedestal and says, oh, you can't go anywhere because we're all better. Look, there are some absolutely brilliant surgeons.
Brazil, yeah.
All over the place, in Brazil, in Colombia, in Tijuana. I joked about Tijuana earlier. There are some unbelievable guys there. And I keep saying guys, people, surgeons.
Either way.
The problem is you don't know who's good, you don't know who's bad.
Right.
It's hard to vet them. That's number one. Number two, you don't get the same aftercare, or in a lot of cases, it's not set up properly. Exactly. So it's a disaster. And some people will not seek out the care they need, or arrange for something to be done in case there's a problem, and then it's bad. And
most people that I hear that do that because of financial reasons.
Exactly.
Like they can get more for less money. Now, let's say those brilliant surgeons, are they going to be comparable in price even though they're in a different country than you guys? Are they going to be a little bit cheaper?
Yes and no.
So it's not really...
Right.
It's not really worth it because by the time you get to the good surgeon, they're going to cost the same as if you just stayed here.
So I have seen a couple of the really good surgeons out. Let's say my experiences with Colombia, and they are charging at this point amounts that are close to US dollars. Net, they still go for something that is less than the United States to make it worthwhile. Yeah, but everything is just so much cheaper in those places.
By the time you pay for your airlines, your hotels,
you save a few dollars, and is it worth that?
And then to fly home with aftercare, because you can't go on an airplane after surgery.
Right.
So you're there for 2 weeks. Yeah. Just sitting there.
Yeah. Well, you should be. And again, some of my friends in Colombia who I think are quite great will mandate that their patients stay for 2 weeks. And I love them for that. I respect them for that, because that's when you sort of get out of that really serious trouble zone. But there are a lot of doctors who will be like, okay, had your surgery.
Whatever you want. We say stay 2 weeks, but whatever.
So one of the housewives had a facial something done, and she got on an airplane and bled out, started bleeding out on her. God. She like exploded in her face.
Oh my God.
I don't know which one it was, but I remember hearing that and I'm like,
that's
oh,
really
she just
scary.
had a facelift and she went on an airplane? Are you fucking kidding me?
Yeah. That's
the
not
pressure.
Smart. That's not smart.
No.
10 out of 10 don't recommend.
I mean, I have to start bleeding out of your neck and then, go. Like, I was like, oh my God, your head's going to pop off.
Right.
This is like a Beavis and Butthead episode.
God. Yeah, it's just, you have to be smart about how you do it. And listen, I mean, I tell a lot of people, it's a hell of a lot more expensive for me to fix it after that has happened. And, it's something you have to consider when you go somewhere else for surgery.
Daily Logic Check.
So I know that, I went to this charity and they helped indigenous children with cleft surgery. And they
cleft palate.
Yeah. And so I remember a lot of surgeons will have, like one time a year, they'll all get together and go help other countries. Or have you been involved in any of that?
So I haven't. And it's a really interesting and kind of a controversial point in the craniofacial community especially. So I did a huge amount of work and research in craniofacial surgery, which is, helping people with either genetic or acquired deformities and stuff like that. And look, there are some surgeons who are among the most talented and well-trained surgeons in the world who are doing this. And the point is that, again, going back to a point I made earlier, it's what they do every single day. So to have a guy like me, who I was trained in this years ago, and I never do it, to say like, okay, I'm gonna go and pack up and go to Guatemala and everything and do this, I'm not gonna give them the same kind of care that a properly trained surgeon in this field will give them. I personally don't think that it's appropriate for me to take care of a little kid like this, where
I agree.
To just say, oh, you're in a third world country, so let some schmuck
who does, that has an education from 20 years ago,
all day long, go do this. It's not right, especially because there is actually a good cadre of doctors who do it all the time, who go to those places. Now, will I contribute to those causes? You bet your ass I will.
Yeah, okay.
Absolutely. And I think that's something that is a really important thing to do.
Well, and ultimately, you're a doctor. I mean, you're a surgeon, you're a doctor. that field of work, what you've chosen to do is to give back and to help and be of service to people. And you chose plastic surgery, which a lot of us, the vanity part of it is more your side of it,
Sure.
But also I think that as a individual who I went through a lot with my body, and I was very frustrated, and I just needed a pick-me-up. I just needed to feel anything better, and I had a little bit of dough, and I was like, okay, I can afford to take that fat off my arms, but it gave me the confidence that I needed. It just did. I mean, I can't explain it. It was just like, people say plastic surgeons, you're just so fake, but really, it's a mental state of mind that has helped me over the years. And now when I go to the gym and I work out, the little bit you took out of my legs, it matters.
You're doing it for you, not for them. If you're doing it for them, that's probably a bad idea. But if you're doing it for you, that's why that should be there.
I love that you're saying that because, in the early days of Instagram, everyone was coming up with stuff. I sort of came up with what I wanted to be a hashtag for my practice. I did it for me. Hashtag, I did it for me. And that is such an important thing.
Very powerful.
Where that is why you do it. And to speak to the point of, it's, plastic surgery, it's so fake and superficial and this and that, or it's solving it's a small solution to a bigger problem. What you have to remember is, how much did you and I talk about every damn procedure that we did? A big thing for me is to make sure that, look, if I'm going to operate on someone, it's going to be for the right reason. It is going to be something where, you're doing, it is a very specific and discrete problem where it's pretty clear that, look, it's just making you unhappy or you don't like it. And a surgical solution to that problem is going to kind of solve the problem and you move on with your life. That's great. Now, there are other circumstances where I'm going to talk to someone and we're going to try to figure out, hey, what are you looking for? How can I help you? All that stuff. And then you start to see some red flags pop up here and there where you get the sense that I don't think surgery is going to make this
this is a mental
much bigger problem go
It's not going to help anything. It's going to get worse.
Asylum and a mental institute.
Well, it's not even that. It's just someone who really is just unrealistic about the things that they want out of my surgery.
Oh, like on Botched. I watched Botched for the first time. Some of these people go in there like, I want to look like a cookie. And you're like, wait, what?
I mean, that's just good TV.
Okay.
That's good TV. Fortunately, I haven't had anyone come in and ask him to look like a cookie, but I've had other variations.
I want to be a rabbit. I want to be. I'm like,
away.
what the fuck?
Yeah.
You want a what? Yeah, some people are cuckoo for Cocoa Puffs. But,
oh my God, so
but
funny.
no. So why do they call it plastic surgery? It seems like they should change the name. Because there's no plastic.
So the name of plastic surgery predates plastic by thousands of years.
Really?
It's from the Greek plastikos, which means to mold. So it's surgery that molds and shapes the body to get whatever the result you want is. It's not because it's plastic like
the modern definition.
Exactly.
It's the ancient definition of plastic.
Which is an unfortunate coincidence that we happen to use silicone implants and plastic butts and this and that. So, kind of the optics aren't great, but that's actually exactly the reason why. And it's funny. That's something we always...
Okay.
I got to do a post about that. I haven't done that for a while. We'll let you know.
Because I'm like, well... If you change that word from plastic surgery to like reformative reconstruction or something, something normal.
Well, so it's funny actually. I think to that point, people will often, and especially in the academic centers, they call it always, it's plastic and reconstructive surgery. It's this, or it's reconstructive surgery. So there is that mindset of, we got to get away from the plastic.
Yeah.
The name of the plastic.
So
you guys are using, the plastic surgery is using probably the same definition that got plastic its name, which is the ability to mold.
Exactly.
Because plastic, that's what you do with it.
Right,
Okay.
So
exactly.
I have to talk to you about this because it's been on my mind and I wanted to ask you. I know that you do lipo, but you're in the surgeon realm. So when people have face implants or transplants, Okay.
Yes, that's pretty crazy.
So I just heard that they're officially, they can, I mean, they've probably been able to do them for like drug dealers and things like that want to go rogue. But, you know.
There's a great movie about that.
Yeah, didn't they? But,
Face Off?
Face Off.
Oh, really? Is that a movie?
John
I'm gonna watch
Travolta
that.
and Nicolas
Nick
Cage.
Cage, right?
Oh,
Nicolas
yeah.
Cage.
Didn't they
Yep.
switch their faces
They switched
or
their
something?
faces.
So good.
Oh, yeah. But is that possible? Now because the neuro...
So this has been probably one of the most incredible advancements of the last 20 or so years, where there has been a huge amount of research that went into this, because it brings together so many different little realms of plastic surgery.
Right.
But yeah, long story short, you can take the face off of a dead or dying person and put it onto someone who has been disfigured to the point that they can no longer be reconstructed. And it's
like a burn victim
like
or
a
something.
bad burn victim. The classic patients have been burn victims. There have been dog bite victims where they were
I've seen
mauled.
it.
All sorts of stuff like that, where we do all the things that we do and they never look normal, and they're not okay. So that when they started face transplants, they started more just sort of initially in, let's say, the nose, upper lip area, then sort of broadened it out, and now are doing full face transplants to the point that actually recently they did, they tried to include an eye.
They transplanted an eyeball?
Not crazy.
That worked or just...
To be determined.
So we're going to be able to break into the space station. Yes. Grab the guy's eye. Just stick it on me. Give me the eyeball.
I mean, we need a movie for that.
I mean, we need to steal the eyeballs
We need
or
to do
transplanting.
Face Off 2.0 or
Exactly.
something like that.
You know, stick some fat in your ball and get a face implant, an eye implant, transplant. No, well, I mean, you think about, you see all these movies where like the gangsters are always,
Right.
they go and they get their surgery done. And I'm thinking, now that we know that The Simpsons is real.
Right, yeah.
They predicted everything.
Oh, they have everything.
So the old movies must have predicted that you can do a face transplant for the gangsters.
That's it.
In at least the few that I've seen, I haven't seen a lot of them, but you can tell that something's wrong.
They don't look right.
They don't look right, but they look way better than they did.
Correct.
I saw a guy, like, he couldn't blink very well.
Right.
And you could tell, like, God, that, but if you weren't looking and they walked by, it wouldn't, like, before the plastic surgery,
exactly,
every person would look at him.
Yeah.
And now just 1 in 10 people look.
Right.
Which is what you're going for.
Pretty incredible.
Which is incredible.
And I mean, listen, remember, we're still in the infancy of this. So like, it's gonna get better. And it's fascinating to me to think,
that's
like,
crazy.
where is this going? I mean, like, the original surgeries, they actually used to intentionally add a lot more skin on the face that they transplanted, just because they were saying, well, we're gonna need it for this, that, or the other down the road, so let's just give more material to work with.
Oh my God! Let's incubate more. Oh my God!
We'll do a tummy tuck later, a face tuck later.
She might need this over here.
That's exactly it.
That's just crazy. No, I think the advent of that, plus robotics, they're adding limbs, they're adding it's kind of crazy. So you think that the robots, the new robots that, the Elon Musk of the world, by the way, Elon's an alien. I just want to let you know. And I'm voting for him for president.
There you go.
Just, if he needs a new face later to live forever, I will,
Got it. We'll do it.
So, I was told that they're going to have these actual robots and be able to put human cells of skin on these.
Someday.
What?
It can.
Yeah.
It can.
That's just
So you'll be
that's a-
sitting next to like an actual robot.
That's called a
and
cyborg.
Oh, it's a cyborg?
A cyborg is a mesh between technology and humans.
But don't they already do it?
Well, I mean,
Or am I
technically,
just watching TikTok too much?
technically,
Watching
people
a
with
little bit of TikTok, but listen, these things start as ideas and they happen.
They manifest, I swear.
Yeah, you look at Star Trek, everything they've ever thought about, we figured out how to make real.
Totally.
They're still trying to make a transporter.
Right. Down the pipeline, but that would be pretty cool.
Yeah, it would be pretty awesome.
I'm telling you, I can't wait so that like when I'm like 150, still alive, if I could
obviously.
transplant this hottie onto my face, I would.
Why wouldn't you? Absolutely.
What's be better is to get a brain transplant. So then you just grow a new body and then brain transplant.
Actually, that would be cool too.
Yeah, that's what I'm talking about.
I would want like a younger, what if you would older?
Take you. You know, and then just regrow yourself again. And then every 20 or so years, you put yourself in a new body.
Please let me be dead by the time they do that. Please let me be dead. Please let me be dead.
But
I'm retiring
But the good thing about that is she'd have to redo all the surgery.
It's more work.
It's more work for you.
And you just have you could redo yourself too. You just work forever.
And if it's screwed up, you're like, yeah, we got 10 years, we could redo it.
No, I know some really wealthy people that are looking for the fountain of youth right now, and they think that they found it in like the Antarctica, or they found it in some alien spacecraft, wherever they found it.
It's new boobs.
It's new boobs and water. I always say, everyone's like, I can always tell somebody that drinks a lot of water, they have good skin. They go, oh my gosh, what do you use for your skin? What do you do this? What do you do that? What do you do this? And how many facelifts have you had? Because I've seen this, woman that I know, she has got great skin. Amazing. And she's like, I just drink water. That's
wild.
I'm like,
she's lying through her teeth.
Really?
But that's also amazing.
Really?
Listen, water only goes so far, okay?
No, but so is there a specific time? Okay, so you've been doing this for 13 years. Is there a specific time that is okay? It's an election year,
right?
Okay, people aren't really spending money because they're nervous, right? They're saying, "Oh, all the interest rates are going up. Everything's kind of the economy's a little bit weird. It's janky."
Yeah.
Are people still spending now for themselves, or do they get more reserved during election years or certain times of the year, or is there like anything in specific that they start doing plastic surgery that boosts it, like festival season,
like a pandemic?
Okay, so what happened with that?
COVID was insane for the plastic surgery world because people were at home. People were looking at themselves on Zooms all day long. People had nothing else to do. They were locked in. They couldn't go out, so they didn't have to worry about being absent for a recovery. And people weren't spending money on restaurants, trips, this and that. So
they saved their money.
It was a big time for plastic.
They didn't save their money. They just gave it to him.
They gave it to me. Yeah, sorry. Keep it coming.
He's the real person of the interview. I'm like, I save money if I buy 10 on discount. Andrew's like, no, you spent more money.
No, you would have bought one and now you have 10, so you spent 3 times as much.
There you go. But yeah, so I mean, that was one. But that was weird, right?
Yeah.
That wasn't a normal time.
Right.
Like, thank God, it's okay. I don't want that anymore.
Right.
But what we've seen is there's definitely a slowdown right now. What is interesting to me is, the last huge slowdown was in 2008, and I was still training then, thank God. But a lot of the plastic surgeons who were working then, they got killed. I mean, there was nothing happening. People were not spending. But what's really interesting now, I think what's happened in plastic surgery is that it's seen much more of as a necessity or an expected part of life rather than just a pure luxury. Okay, so what I'm seeing is that people still want the procedures, but in a tougher economic time, they're just sort of stretching it out a little bit longer.
They're not asking you for one boob versus 2.
No, I haven't done that yet.
So much for just the one boob right now.
Yeah. Instead of one procedure a year, it's one every other year.
Yeah, exactly.
Exactly. I see. Okay,
so they're going to get it done. It's just eventually
it's just more. People accept it much more. I mean, think about now versus way back when. To talk about plastic surgery, the fact that you have me on the show, it speaks to the fact of how much it's a normal part of our lives. In the past, it was way more niche, and people weren't really open about talking about it, and they weren't as open to do it, especially when it was a tough time.
But I think, what is it, the mommy makeover? Didn't that really bring plastic surgery to the mainstream? Because almost every woman that has a baby wishes she had a mommy makeover.
It's a big part of it, for sure. I see it all the time.
Yeah.
It's something I specialize in. And
you specialize in mommy makeover?
Oh, yeah, I do.
Really?
That's my thing.
So what is it? Is it tummy tuck?
Well, all a mommy makeover is more than one procedure to fix what the damn kid screwed up.
Okay, so
the ravage the body.
Usually it's some breast procedure and a tummy procedure. Classically, a tummy tuck and let's say a breast lift or breast augmentation and lift.
What is a tummy tuck? Could you explain this?
I can.
I don't even know what that is.
Okay. the best way to think about it is to look at your torso anatomically, right? There are basically three things you need to think about. There's the skin, there's the fat underneath the skin, and then there are the muscles underneath that, okay? When someone has a major body change, weight loss from, anything, baby, absolutely, any of this stuff, what happens is they have a lot of loose skin. They usually have a little more fat than they want underneath the skin, and their muscles are all stretched out. What a tummy tuck does is it will tighten up, so it gets rid of extra skin, usually in the lower abdomen, and then it pulls down the upper abdominal skin to tighten it up.
They cut a piece
because
out.
you can't do lipo. Lipo's just the fat cells. This is actual
Lipo is
skin.
just the fat.
Your skin, if it
So-
stretches too much, stays big.
Exactly.
If it has some elasticity, but sometimes if it gets too big, when it shrinks, it's still bigger than you want it to
Exactly.
be. So
Thank
then
you,
they just,
Surgeon Andrew.
So then they just cut a piece
got
out.
it.
Then they just cut a
got
piece
it.
out and staple it together.
I want you to, we're working together now. He's coming to the office.
We call
with
him
me.
Andre. He's the new Alexa. Or Alexa. Andre, what is a tummy tuck mean? So basically,
okay, so tummy tuck, I'll even say surgically what you do. Little incision around the belly button, low abdominal incision. You take that skin, right?
Okay.
You literally lift it up off the muscles.
Okay.
You dissect all the way to the rib cage. Then you're looking straight at those two six-pack muscles, which usually are stretched apart. Okay, that's what's called a diastasis recti. You sort of hear this all over the place. You sew the muscles back together, and that will flatten the stomach. It'll actually bring in the waist also. Then you take all that extra skin and you pull it down and you tighten it down and you cut out all of the extra skin so that extra skin is gone and whatever is left is nice and tight. Now the belly button always stays attached to your body, but it's now underneath the skin. You just pop it out into a new position on the abdomen.
So crazy.
And that's a tummy tuck.
Wow.
So do those, when you stitch the muscles, do they regrow after you, do you actually cut the muscles? And
No, you don't cut them.
Okay.
So the muscles are encased, kind of like a sausage has a casing on it.
Yeah.
The muscles have a covering on them. And what you do is you sew, you bite onto, literally with your suture, you grab a piece of the covering on one part of the muscle, the other part of the muscle, and you bring it together.
And that's good enough to when they use the muscle, it doesn't go back out?
Here's an interesting thing, actually, because a lot of these women's muscles or patients' muscles have been separated, a lot of them have a lot of weakness in their abdomen. They have a tough time waking or sitting up, or they'll have back pain or whatever. We found, there are studies that have been done, that when you put those muscles back together, their abdominal and core strength improves, their back pain is better, they have better posture.
Well, yeah, because
all
now
that
they're in the
stuff.
right spot to do their job.
Exactly. That's it.
But does a tummy tuck, does a mommy makeover include labiaplasty?
It can.
Okay.
Yeah,
Because
we
that's
have
been
one-
screwed up by the kid too, right? That's kind of like, "Meh."
Exactly. Yeah. Yeah, you can totally.
They do a really bad job at the hospital, and you make them
Yeah, I think so. now.
Couple
stitches.
They build a canyon over there, and you fill in the.
Daily Logic Check.
No, it's interesting. Plastic surgery in general, my audience, I have a lot of women that follow me, and really smart women that I know are like me, who don't really want a big change, but we want a little bit of love. And I think that a lot of, there's not a lot of you out there.
Okay.
And, I know that I can call you and say, look, I need a little bit here or here, but I don't want a lot. And you're very honest. And I love that you're honest. And I think on my podcast, I'm going to put on the video a link to you and your practice. And you might get some calls on, who do I go for my butt cheek? My right one's sagging and my left one's going that way. But no, it's great to have an ecosystem of doctors that take care of you, especially aging women. I mean, beauty is in the eye of the beholder, supposedly, but really beauty is in the eye of Instagram. And so
That's all fake.
it doesn't matter. We still compare ourselves
And you
regularly.
shouldn't, but you should.
But we do. And
get it.
even on The Housewives, I was going through divorce, fat and happy. And I was like, oh God, now I got to get skinny.
Oh my God.
But then I saw them, I'm like, nah, I don't got to get too skinny. And
It's just important to be happy.
yeah, it's just, but it's also to be happy today with I think there's going to be a huge boost in plastic surgery because all these little girls that are on Instagram that think that they're amazing and they're beautiful are going to all of a sudden not feel amazing and beautiful when they start aging because they're all hot right now and they're going to want all your surgery. So there's going to be like this big boom of women getting surgery to try and look what they used to look like, worse than there's ever been. Like right now, I'm at the age where I'm that older generation where, okay, I'll do the little These girls have been so praised on Instagram by all their creepy followers that they're like, God, I need that ego fed again.
This is such an interesting and important point because if you notice, I'm sitting here like a little uncomfortable and squirmy.
You are.
Yeah, because that scares me, and that scares me not unless I've got a beautiful daughter who's just about to get into all of this shit. But the point is that these unrealistic, crazy expectations and stuff like that.
The Instagram expectations.
It's gonna make my job harder because I'm gonna say no to more people because they may not understand why are they asking for these procedures, what do they expect, what can they get, and what should they not. And I mean, I've already said no in a lot of those cases. And look, I love to do the work that I do. I think I do great work. I enjoy doing it. My patients are happy, all that stuff. But a big part of that is because we do these things for the right reasons, for the right person, at the right time.
Yeah.
And, you know, your point is really interesting to me, Elizabeth, because you're correct.
Yeah.
You're totally right that this could potentially be a flood of people coming in for work that, you know,
it's unrealistic.
Yeah,
you're going to have to fulfill those shoes, but they're going to have to be fulfilled realistically. And my take on it is that there should be some sort of standardization where if you want a procedure, by law, you need to take this class. And after you're done learning about the procedure that you want, you take a test. If you pass, then you find your doctor and you know, yes or no.
Let's not make plastic surgery like the DMV, please.
It's going to be. They're going to want In-N-Out Burger. They're going to go, I want this done and I want it done. I want to recover tomorrow. What do you mean I can't fly an airplane tomorrow and jump off, go skydiving?
But my daughter's mother, she got breast augmentation. And what's funny is I like to know, and I'm the one that told her everything because I did all the research and I was like this and she's like, and no one ever said anything and made her more educated and therefore she was more comfortable.
I love that.
And she made the right decision.
Love that.
And I was like, you know, I want to know.
Right. Right. So I mean, you're my poster child. That's the best thing.
He's got a daughter too who's like gorgeous.
I'll probably never get any plastic surgery, but I want to know just in case I ever decide to what it would be.
Andrew, you're just gonna fix your toe for OnlyFans?
No,
make it a little bigger.
You'll be huge. Trust me, you'll be so famous.
No,
I love that. I mean, the education thing is so key, and it's. I mean, in everything that we do, you buy a car, you want to know.
Exactly.
About the car.
People
Back
research
to the DMV.
Yes. You'll spend 4 hours researching what kind of car you like, or weeks on end. But then these get plastic surgery, and they're like, just listen to what their doctor says and don't research.
I've had both. I've had people who have done. You know, you have the whole spectrum, right? People literally will go in and say, okay, I'm just going to do this. And they don't realize that this is like a massive undertaking.
Yeah.
They have no idea what to expect, no idea what to do. And it's a mess. On the flip side, I've had people who just have done so much research and it's bad research. Google, is not always right.
No.
You know, and then it's just this other side of like, what about this? What about that? What about this? What about that? And it's, you know, it's just bad information.
Yeah.
What I hope for is someone who's sort of smart about the research they do. They involve me in the research. They talk about things.
Yeah.
We go over
what
things
is this?
together.
And I heard this, and which is real, which is not.
Yeah.
But people are lazy. Yeah. People are so lazy.
People are lazy. They don't just want to go get it taken off so they go to the gym.
No, stop talking to me and just do it.
Treat me like a banana.
Stop talking.
Strip me clean.
So funny.
And everything. That's what everybody does.
I mean, you got to do your research.
I don't think I know a lot, but because I always do research on
I
everything.
disagree with you just based on this last hour, okay? But
to me, it doesn't seem like I over-educate myself, but I do. Compared to everybody else, I think I educate myself not enough. But compared to everybody else, apparently I just I always am looking and researching, and I just want to know. I don't need to know. I just want to know.
Here's another thing that, I mean, this has nothing to do with plastic surgery, but actually I love this point of, now it is as much an art to know how to do good education.
Yes.
Like, I bet you
That's
you're very
true.
good at hashing out the bullshit and saying, like, this is good information and that's stupid.
I was just talking.
Yes, yes.
I was just talking. I don't know if it was Elizabeth or Michael, but I was just like, it's kind of weird that Googling something is an art form.
It totally is.
You can't.
Oh my God, I love that. I love
It
that.
is. You've got to know. I've learned how to use Google
Yeah.
to get the information as quick as possible
Yep.
and the most accurate as possible. Because you Google something, I Google something, I'm gonna have a better. I'm gonna have a better answer than you in
Yeah.
the same amount of time.
Yeah.
And it's really. I didn't. It doesn't seem like it should be, but
it
it
is.
absolutely is. So I mean, that's what everybody I know
say what
calls
doctor
me to
should-
let me research it because
Oh my
I know
God,
they'll get the
that's
better.
so
They'll get the
funny.
better information if they
I
let me
could
get.
see it in you. I knew that.
Well, Dr. Gabbay, it has been such a pleasure today.
This was amazing.
You were educating my audience. You are my body architect all the way
Oh my God,
around.
that's so sweet.
Andrew, do you have any other questions for Dr. Gabbay? Like any
I've just got one
procedures you want to do?
Yeah, no, I don't want to do it, but it's one procedure. Have you ever seen somebody who's gotten their height raised?
What?
Yeah.
It is because I know it's a big thing in China.
I have
so,
one of my friends actually. He's Instagram is height lengthening. He does that
here. Wow,
He's
because
huge.
last time I researched, which was years ago,
Yeah.
it was a big thing in
They
China.
break
It
your
was-
knees, right?
No, they do it either at the
They break. So this is actually an
Their
area
feet-
that I studied a lot for craniofacial surgery. They break the leg. They put basically what's called a fixator on it. They put something in there into the bone to stabilize it. They break the leg, and then little by little they
just
crank
it and
They
make you
crank
taller.
it, and they lengthen it out.
What movie? Wait, the movie. There was a movie that they had to do. That was a futuristic movie. It was.
Yeah, it
No,
was.
it
I
was
forget
the,
what that is.
the guy that walks like the Einstein. No, the monster.
Jude Law was in it because he was the guy that was in the
Oh my
wheelchair.
God, what was that? I gotta find
It was
this.
such a really good movie, but that's the first time I ever heard of it. And after that movie, I researched it, and it was a thing in China, but it wasn't approved.
It's huge in China. It's really big there.
You
and
can get
then-
2 to 3 inches, right?
Yeah. Yeah.
Okay, back
Yeah.
to the logic part of this whole thing. I don't want to raise my height.
I was just curious about it.
No,
So-
it's good. My friend Dr. Mabubian does
Mabubian?
it. Yeah, he's awesome.
Okay,
so,
Dr.
you know,
but that's it.
Mabubian.
I just wanted
You
to
wanna
ask
get
that while you
taller,
were
go
here.
to Dr. Mabubian in Beverly Hills. Dr.
we're-
Gabbay referred you.
So I was just kind of curious.
It's really interesting.
Yeah, it is kind of a crazy.
Well, somebody
procedure.
went under the botch and wanted to get shorter. So who knows? Like,
No way. That's
yeah,
so
I just
funny.
saw that. I was
That's
like-
actually really hard.
She's like, I
Yeah,
want to
that would be a lot harder, don't you
Yeah.
think?
Yeah,
Because you'd have to constantly just do the same
Chop,
thing, but go
chop,
back,
chop, yep.
keep chopping out pieces and
Oh,
putting it together.
God, that's miserable. All right, there's our
All right, well,
tangent.
anyway,
There's our
that's
tangent.
That's for
At
a
that
whole
note- on
nother
that note.
episode. Whole nother episode. No. So on our show, we love to have guests on that really have created a life where they give back. And I think you being a doctor, you give back, and we'd like to give back to you by giving you $1,000 for a charity of your choice. I
love that.
So do you have a charity in mind?
You know, actually, because we spoke about it and to sort of harp onto something that has been so important in my life, I would love to give it to Smile Train, which is a charity that's dedicated to repairing craniofacial defects or issues in children from around the world. So cleft palates, cleft lips,
Smile
stuff like
Train.
that. Smile Train.
Okay.
They are amazing. They do beautiful work. They really, really, they are the group that just make children's lives better throughout the world.
And where are they located?
I have no idea.
Are they? I mean, they're in the States, though.
Yeah, they are in the States.
Oh my God. I'm not
They're
like
in
what
Boise,
state.
Idaho,
I'm not-
on 5th Street and
Wow, that's very-
Washington.
Right
That's
at the
very
Burger King. Okay, well, I'm thrilled that you like that nonprofit because I love when a child smiles, and I see some posts like that, and it just the before and after pictures. So we
they're
will
incredible.
for sure, Angie and I will be donating to that charity.
Thank you. That's so sweet of you.
We also give a little gift for you for being at the first 10 of our guests get a little gift from Andrew and I.
I love it.
If I could reach it.
I'd just move your mic. Yeah.
Okay. I'm trying to learn how to do this smoothly without like spilling my
over.
champagne.
Oh my God, I love this.
Okay, so obviously
see the
little
things.
Vargas swag.
We
You
got
know,
it.
get that.
Oh, I love it.
Shameless
I love
product
that.
placement.
Shameless plug, whatever.
Hell yeah,
Who
I'm gonna
cares?
just
Little
walk
hat,
around.
Travis
Oh my
Matthews golf
God, I
hat,
see
little
something.
shirt.
I see something in a special color of. Guys, you're so sweet. Thank you.
You're welcome. Well, because Beverly Hills and Tiffany go hand in hand. I mean, the name probably comes up a lot. No, you got to open it.
Oh my God, I will. Well, the name really comes up a lot because it's also my wife's name, so that makes it even
That's
more
right.
special.
Oh, tell Tiffany hi.
I will.
Well, it is?
Yeah.
Oh, this is
I
exciting.
love this. Well, thank you. I can't
You're
wait to see.
welcome.
So, here we go. Are you ready?
Because you make your pennies doing those surgeries.
I love it. We're going to
it's
fill
a
this up.
Tiffany money
Yes.
clip.
My only concern is that Tiffany's going to see it and says it has my name on it, so it's my money.
Nice.
No, we're like, okay, we'll get that back. I
Nah,
forgot
I
your
love
wife's
it.
name was Tiffany.
Yeah.
That's great. Tell her
That's
hello.
it. I will.
And thanks
I
so much
will.
for coming on and
Thank you
being
for
a part of
having
our
me.
launch. We love you.
This is beautiful. I can't wait to see your podcast grow. It's so fun, and I can
Thank
only
you.
see this getting better. So
Peace, love, and happiness. And thanks for watching this episode of Daily Logic Check.
Daily Logic Check.
Thank you for tuning in to this episode of Daily Logic Check. I'm Elizabeth Vargas, your host, with my co-host, Andrew Vargas. If you like what you saw, you like what you see, click like, subscribe, follow us, and support us on Patreon. Peace, love, and happiness.
Daily Logic Check.